yesterday we have learned the importance of diagnosis followed by importance of therapeutics, how it has been used, and auxiliary measures along with the homeopathic treatment, how much important they are. That aspect Krauss has mentioned over there, and he has mentioned each and everything, right from the food, the air, the exercise, the massage, the suggestions, all things he has taken into consideration. And not only that, but along with the hygiene, the sanitation, how they plays very vital role in treating the diseases. Then importance of surgery in the homeopathy. Then importance of importance of surgery is basically in three types of diseases where there is a any deformity, congenital deformity is there, or if there is a surgical malposition, mal displacement is there. All those things he has tried to explain over there. So how one should develop their logic when he deals with the homeopathy, that aspect we have learned. Then we have started with another paragraph, and where Hahnemann mentioned two words, tolecosm. And Hahnemann mentioned this against the modern medicine because they know, they consider that they are rational practitioners of healing art because they used to use tolecosm. They know the cause of disease. And Hahnemann says, how can you know the cause of the disease if it is hidden in the interior? Even the disease is hidden in the interior in the dynamic form, and still you say, you know, you treat the tolecosm. And then he explains over there, there is only one way with which we can understand disease, that is the language of the disease in the form of signs and symptoms, that is in the form of effects, and that there is only one way to treat or handle the cases, Caesat effectus, Caesat causa. You remove the effects, you will remove the disease, the cause of the disease. And this is what we have learned. And this is every time it is not possible to get the antecedent causes from the patient. Many patients never answers the antecedent causes, but you have the totality and with which you can approach. Then he compares what is unscientific medicine and what is scientific medicine. The comparison he has mentioned over there, and he explains over there. There is one word which he has used. Empiric medicine is the medicine which is based upon gaze. The scientific medicine never gazes. Then another thing which he explains, this whenever it is a scientific medicine, it is the medicine which compares effects with another effects. It analyzes one thing with another thing. It is the thing which is used by human mind, and that comparative aspect which a human mind thinks, that is the scientific mind. And homeopathy always utilizes all those measures while treating the disorder. And this is what up to that sentence we have finished yesterday. The scientific medicine, like any other scientific art, compares effects, sensations, and motions with corresponding effects, corresponding sensations, and motions. This is what we have finished in yesterday's lecture. Let us go ahead with that paragraph. What he says about science. Only the mountebanks in the medicine decry the methods of comparison as unscientific. Mountebanks, those who never understand the value of homeopathy, or those who have their own ego, those who used to think that unless and until we criticize homeopathy, we will never come up, like a psychotic personality. And James Krauss criticizes them by the name of mountebanks in the medicine. Decry means to devaluate the methods of comparison as unscientific. These are the people, they say this is not scientific, comparing is not scientific, and this is wrong. When we choose, a simple example is that when we have to purchase the cell phone, what do? How we scientifically come to a right cell phone? We compare one phone with another, varieties of the cell phones we used to find it out. And then we find it out merits and demerits of each and every mobile. And then ultimately, after comparing, finding it out the truths, and then reaching to a, yes, this is the mobile which I expect. This is the scientific mind. This is the logic. This is the Lord Bacon's logic. Hahnemann have utilized the same thing in his life. And that's why when we deal with the patient, we compare the patient's symptoms with the symptoms of the medicine. This is the simple way. And that is scientific because we are prescribing it on the specific law, and that is called a law of similars. So law of similars is mentioned in two ways. First law, which we have discussed on the day first, a drug capable of producing in a healthy individual a disease state exactly similar to that happens in a diseased individual, acts as a curative agent if the disease is in a curable state. This is the first thing which we have learned and on the day first. Another same law, if it has been said in the dynamic form, it is nothing but the 26th aphorism, which is nature's law of cure. A weaker dynamic affection is permanently extinguished in the living organism by a stronger one if latter is very similar to former in its manifestations whilst differing in kind. And this is what the law is. And this law is scientific. This is nature's law. This is therapeutic law, and which we are using while comparing the things. So it is the thing which is scientific. It is not at all unscientific. But people who doesn't know anything, they criticize this homeopathy. All that we can humanly do and scientifically do is to observe and classify, to compare and infer. This is the human mind. This is the human logic. This is with our logic works. We first induct, then we compare, we analyze, then we evaluate, and then we come to the conclusion. This is the human mind. This is how it works. It works with four important stages of inductive reasoning: the exact observation, the correct interpretation, the scientific construction, and then rational explanation. It works in these four phases, and this is scientific. Homeopathy do each and everything following this criteria. In fact, homeopathy was introduced to the world by these four methods, and that's why it took 6 years for Hahnemann to explain it rationally to the world in 1796. Only he was knowing it in 1790, but he has not declared it on day first. He has first scientifically proved, he has experimented and then reached to the scientific truth. Hahnemann says we must apply medicinal substances on the basis of knowledge of their actual effects. Hahnemann was the first one who said that if we want to use any medicine, it should be first actually known. It should be proved on healthy human being. We should know each and everything what it used to produce in healthy human being, whether it produces any subjective symptoms, whether it used to produce any objective symptoms. All things you have to take into consideration so that you get holistic data about that drug, and then you use it on the human beings. This is what the Hahnemann's conception was there. Since it is impossible to know all the antecedent causative of the disease consequence, we must treat the disease effects which we do know by medicinal effects which we have ascertained and know. So what is explaining over there, that when we deal with the cases, many times we can get the antecedent causes, but many a times we never get antecedent causes. Patient comes to you and patient says, doctor, yesterday there was a very much rain and I got wet in the rains and I got the coryza and cough and fever and restless. Here you get the antecedent causes. But sometimes patient comes and they comes with some presentation or very few symptoms, one-sided diseases, and they don't know what is the reason behind that. Patient comes to you, doctor, this is the patch and this is the white spot have come on my face, and this is the only thing. If you ask them what has happened previous to it, he says nothing. You don't know antecedent causes over there, and still patient comes to you. So what to do in such types of cases? In such types of cases, you have only one thing. That is, you must know the symptomatology. You have to depend upon what the patient presents, how the patient presents, how he looks towards that specific disease. Or sometimes patient, you are called in ICU and patient is lying over there in a comatose state and he is like this, and he's falling as if from the bed, and he doesn't have a strain to sit properly. He doesn't have a strain to close the mouth. It is falling down. And that is what you have to look for. And they are trying their level best, giving IV fluids, everything, but nothing is working. So much debilitated state is there. And he is not in a condition to tell you antecedent causes. But only thing is that you must have a perceiving eye, you must have a perceiving ear, so that you can understand the patient who is in a absolutely comatose state, semi-comatose state, lying over there, falling on one side, doesn't have a strain to sit. His mouth is also wide open. It is falling like this, and he is in a dead state. If you try to stimulate, nothing is coming out, but still he is in such state. You don't know antecedent causes. But basically, in such types of cases, you have to find it out on the basis of what are its effects. If you get the effects properly, if you open your Allen's notes and read it under the picric acid, you will get the same picture over there. And then you prescribe the picric acid, and after picric acid, you will find yes, picric worked, and immediately the patient got the consciousness, the strain, the energy, and this works. So ultimately, it is based upon the signs and symptoms, the effects of the disease, and you have to compare those effects of the disease with the effects in the medicine. So you have to compare it from the disease to the medicine, and this comparison is scientific because you are using it on scientific law. Since it is impossible to know all the antecedent causative of the disease consequence, we must treat the disease effects, which we do know by medicinal effects, which we have ascertained and know. Disease effects are removed by application of medicines having corresponding medicinal effects. So disease effects will be completely removed if you choose a perfect simillimum having the similar type of presentation. So law of similars, if you would have utilized, same medicine which has the capacity to alter human state of health at the same level works as a curative remedy. If the disease effects are removed in toto, we have cure. Simple definition of a cure. What Krauss says is very simple. If you remove the disease effects are removed in toto, we have a cure. If you would have treated that totality of the symptoms at a time with your remedy, everything is lost and patient becomes again healthy, a cure is achieved. Simple definition of palliation, next sentence. If the disease effects are removed in part, we have palliation. So if you have taken into the consideration the totality, you have matched a remedy, but which never cured whole totality, but part of it is removed and part is still remaining, it means the palliation has happened. Generally, antipathy and allopathy generally works on this specific principle of palliation. They used to give symptomatic treatment. They never considered totality of the symptom, but they consider basically the part of the symptoms. And that's why for one symptom, they give one remedy, another symptom, another remedy, and they try to palliate the things again and again. So if you treat the patient and only part of it is cured, it is called as a palliation. Scientific comparison of disease effects and medicinal effects for application leads to the diagnostic inferences of scientific medicine, makes scientific medicine possible. So he was the first one who started with this scientific comparison. He was the first one who has started giving importance to the disease effects. He was not happy with the way the modern medicine was doing. They used to just see what is there any sign. They used to just gaze. It might be because of some material cause over there and try to remove that cause by any means. It is not. There was no judgment. There was no speculation in homeopathy. It was just simple. Apply the law of similars, find it out what are the symptoms of the disease, and find it out what are the symptoms of the medicine, similar medicine, and apply that medicine on the basis of symptom similarity. This method, which is developed by Hahnemann, is very clear and scientific. There is no need to label the disease at that time when you use the therapeutic. And this is the way with which Hahnemann started making homeopathy as a scientific medicine. So it was possible only because of Hahnemann. In 1790, Hahnemann made his celebrated experiment with China. From that time to 1839, that is in the course of about 50 years, he experimented with 99 drugs. Underline 99 drugs. MCQ. How many drugs Hahnemann have proved? 99 drugs. He experimented with 99 drugs and recorded his observations of their actions on human body. This record, found in his Fragmenta de Viribus Medicamentorium Positivis, Materia Medica Pura, and the chronic diseases, is the largest, the most accurate, and the most fertile of all investigations into the medicinal action made by any single observer before or since Hahnemann throughout the annals of medical history. What he is saying against the Hahnemann? He says that he is the first person who has in the field of medicine or in the history of medicine for hundreds of years, who singly experimented on the human being with different medicines, 99 medicines, written each and every detail. If you would have not read the chronic diseases written by Hahnemann, you use it and first open it and find it out how he has made the proving. Or open the Materia Medica Pura written by Hahnemann. You can find it out, the date, the timings of the prover, even sometimes in short, the name in initials. And then he has written at what symptom was he got from that prover. So chronic diseases or Materia Medica Pura gives you each and every detail, and he was the only person in the field of medicine who has done single-handed proving, and he has made the detailed understanding of the medicines. So this is what is the scientific, because here he gathered the subjective symptoms as well as objective. He has given maximum importance to the subjective because subjectives are individualistic. They individualizes one person from another person. Subjective symptoms, what the patient feels, and not observable to an observer, but they are related to the inner human core. They are related with the sensations, they are related with the location, they are related with the modalities, they are related with the concomitants, and that defines the individuality of that human being. And that's why subjective symptoms written in such a manner by a single-handed person, this is too important. So we must understand all those things, what he has mentioned about it. Hahnemann was in all essentials a flawless experimenter. Flawless, what is flawless? Nirdosh. It has not having any fault. He was flawless experimenter. He took 4 drams of China twice a day. He had paroxysms of chill and fever. In his practice as a physician, he had seen similar paroxysms of chill and fever. He had cured them with China, the Peruvian boar. This is how Hahnemann experimented. When he was translating Cullen's Materia Medica, on one page it was written the China is the remedy, or cinchona is the remedy for the malaria, and on another page it was written that cinchona used to produce the malaria-like symptoms. The scientific mind never tolerated that. He said that either one of the sentence might be correct, and that's why he experimented with second sentence that cinchona bark used to produce the malaria-like symptoms. So he took the 4 drams of China or cinchona and suffered from the similar rigors and chill with the malaria-like symptoms. Then he had many patients who were suffering from the similar type of chill. He has given the China to them, and he found, yes, it has cured the malaria. And then the induction developed in his mind that there must be some correlation. If medicine, which has the capacity to produce the symptoms, if you get the similar symptoms in the patient, that medicine cures that. That thought, that law of similars was just an induction in the 1790s. But before that, people were knowing the China. They were using the China for the malaria. but they were not knowing the scientificity of it. They were knowing that China cures the malaria because it is bitter in taste. That was the thought in people's mind. But he was the first one who experimented, and he showed it with experimentation. It is not because of bitterness the China works, it is because the China has the capacity to produce the malaria-like symptoms, and that's why it works in malaria. He was scientific, and he came out after 6 years with the law of similar. So what he says further, he had cured them with China, the Peruvian bark. No longer might it be said that Peruvian bark cures paroxysms of chill and fever because it is bitter or astringent drug. The true inference stood out boldly. Peruvian bark cures paroxysms of chill and fever because Peruvian bark produces paroxysms of chill and fever. So this is how Hahnemann came to the scientific understanding of the Peruvian bark, why it works. The necessity for the methodical discovery of the medicinal properties of drug was made apparent. He who says that Hahnemann should not have experimented on himself, but on dogs or cats or rats or mice, has not yet entered the school of scientific logic. There were people who used to say, what they used to say? They used to say that why Hahnemann have utilized human being for proving? He should not have used the human being, but instead of that, he should have used, or he should have worked with the animals like cats, dogs, etc. Then Krauss says, if they are in such a state that to experiment with cats and dogs and mice and rats, then they are not entered into the school of scientific logic. What Hahnemann have done is the using scientific logic. Because once you proved it on healthy human being, you know each and every detail about it. You understand each and every detail about it. And that's why Hahnemann was more scientific. Disease manifests itself not merely by objective signs of sensory impression, but also by subjective symptoms of motor expression. And this is common. Generally, whenever a patient first develops the disease, it generally never comes out directly with the objective signs, but it generally comes out with the subjective symptoms. This is too important to understand. Nature always first give the signals, and signals are always the scientific, signals are always the subjective, and they generally are the first language of the disease. So there are many patients who come to you, they are having certain specific symptoms, doesn't have any sign, but they explain, yes, doctor, I am having such and such type of headache, and I have it very specifically. It starts from the front and then it goes up and then it settles on the back, and they are having constipation associated with it, and it troubles them a lot. It is more and more severe character. So they comes to you with such a thing. And then if you don't treat them with this symptomatology, they may land after few years into some tumor over there. Because biological law always works. The function creates the organ. First, the function gets affected, and then gradually the organ gets developed. In the similar manner, whenever the disease has to happen, first the function subjective symptom used to come first. And if it persists for a very longer time of duration, it turns into the pathology. So subjectives plays a very vital role when in the treatment, because that is the preventive of the further pathologies, that prevents the changes in the organism or organelles. And that's why Hahnemann was the first one who has leaded with the subjective proving. And that subjective data is so important when the disease is at functional level. Treat that at functional level so that there will be no further advancements of the pathology. Can human experimenter, what he says further, can the human experimenter record the subjective feelings of dogs and cats and rats and mice when the dogs and cats and rats and mice cannot communicate to his understanding their subjective feelings? He says that if you would have worked out with these cats, rats, dogs, how can it be possible to understand the subjectives? They cannot communicate. You cannot get the subjective. And if you don't get the subjective, it is as good as the proving done in modern science. The same would have been there in the homeopathy. But Hahnemann was not like that. Hahnemann was more scientific. And that's why he utilized the human being for proving. there are no two human beings entirely the same in the health and disease. What he says? There are no two human beings entirely the same in health and disease. So there are two human beings, even though they are real brother and sisters, they are different. And then he puts question: are dogs or cats or mice or rats are more nearly like to human beings than the human beings are like to one another? Very scientifically, James Krauss puts it that how can it be possible that if two human beings are not very similar, how can the rest of the animals and humans are equal? And this is the question he puts against the allopaths or against the modern medicine, that how do you criticize the homeopathy if it has if the drugs are proved on healthy human beings? How can you say it is unscientific? In fact, our science is more scientific than any other science because we have proved it on healthy human beings. I think this is too important to understand. This is how he explains the scientificity of the homeopathic medicine. And this is the way to go ahead with the scientific approach. I think we'll stop over here in today's session. If we have a chat, that will be better for last 5 minutes. Tomorrow we'll continue with the next paragraph so that we can understand in a better aspect instead of going fast. So there might be many questions which arises. There are many practitioners. The Harsh, there is Nisha is there. Then even Imam is there. There is a Amit is there, Dr. Amit, Dr. Madhu. Madhu, you have put one question in yesterday. Just can you ask me directly?
Yes, sir.
Yes, yes.
Vidurka?
Yes, you.
Sir, in deep pathological cases where we are getting nice result with the present 200 potency,
Hmm.
then after how long time period we should step up the potency, or we should continue it with the 200 only?
Basically, first important thing is that there is no why to, if it is working, then wait. If it is
Okay,
working,
sir.
there is no need to repeat it. Every time
Acha.
when you take the detailed case, detail follow, if you are
Ha
finding
ha.
it out, if it is working, should not change immediately. Wait for the result. If you find that now it is exhausting its action, it is a time to repeat. Then you think whether to repeat, whether a patient is asking our patient is in same state and same susceptibility, you go with the same potency. But if patient susceptibility is altered, if it is too high, you go up. If it is decreased, then you go down. It is not a fixed law that after 200 you must go for 1 m or 10 m or 10 50 m. It is not law. It depends upon the situation. And if the remedy is same, then you have to judge the susceptibility. And then you have to judge whether to repeat or whether not to repeat. If it is working properly, don't repeat. It depends. So it is part and parcel of judgment. You have to judge accordingly so that it will definitely you can think about it. And second
Yes.
important
Thank you.
thing, you have asked one more question over there. Is it necessary to give it in liquid potency?
Ha, yes, sir.
Yes, every time it is not needed. If you want to do a repetition, liquid is always beneficial, but it is not so convenient for the patient. You must think about two things: whether it is convenient, that also you have to take into consideration. Second important, is it really necessary? If it is really necessary, go for it. If it is not really necessary, don't go for it. I'm making more trials on the even with applying the LM potencies. I never used to follow the Hahnemannian protocol to give the how the to give LM potency. I used to make many trials. I used to give it in doses form, and I used to ask the patient to swallow a single globule, put it in that sugar of milk early in the morning, empty stomach. Don't take water or anything in the, and that is convenient way of taking the medicine, and it is working. Sometimes I used to dissolve that one globule in a 400 450 ml of water after saturating with sugar of milk, and I put it in, and that 450 ml thrice a day or twice a day depending upon the situation, I used to ask the patient to consume. it becomes very simple. I used to ask them every time you have to take, just give 10 succussions, and I used to tell them how to do a succussions, and then patient can consume. It depends. You must make your use your intelligence. It is not necessary that it should be followed in the similar manner. Our intelligence we have to utilize and follow. And if you find it very convenient, if you find it right, then share it with others. This is simple me.
Yes,
So,
sir.
is there any other
Sir,
question?
one more question एक विचारायचं होतं परत.
बोला.
So if patient is on 1M, so we can bring again, according to his susceptibility and judgment, we can again bring him to the 200 potency also.
Yeah, you can go for 200, you can go for 30, you can go for 6 also. It depends how at that time the patient situation is there and susceptibility is there. It is not a rule to go up and up.
Yes. Thank you, sir. Thank you so
Okay.
much.
Okay.
Sir, one question,
Yes.
if we have time.
Yes.
Sir, a patient of PCOS, she is a CPA lady, and I want to ask, can I give a palliative remedy with the constitutional? Like if she has very much pain in those days, so, and CPA is not doing well as a pain reliever, so can I give any palliative?
Why not? First important thing is that acute state is different rather than chronic. PCOS is a chronic disease where you will require chronic remedy, whatever may be the patient's constitutional. As you said, if it is sepia, you give the sepia for the constitutional effects, because constitution will not going to change within a day. It takes a long time to work. But if patient is in agony for acute state, the acute demands are different. Acute state is always expressing in total different way. It patient is in agony, bending double, severe pain in abdomen, getting very severe colic. All those things are there. Feeling better only by hot application. More on pain, so more radiates to right lower leg. They are like crampy. They are like neuralgic. Then you have to think of MACPOS, and you can use MACPOS at that time, depending upon that situation, even in 10M potency also for that timing. It doesn't alter the sepia's action, because sepia is working in different plane, and sepia you are not repeating. So you can go with the acute remedy at that time, definitely.
All right. Thank you, sir. Thank you.
Okay, the very less time is there. Thank you very much for attending sessions daily, and ask your colleagues and friends to join over this motto of learning the homeopathy. Thank you being there. Thanks a lot. Thanks everyone.
Thank you.
Amit will talk tomorrow.
Yes, yes, yes.
Yes.